The new normal requires new networking strategies to reopen, remobilize, and rebuild operations using human ingenuity, inspired creativity, and applied digital innovation. Join us for an exchanging of ideas and a showcase of strategies from our customers across multiple industries. Welcome to our live webinar, Embracing the New Normal in Healthcare. Healthcare organizations have been at the front line of the pandemic, and we've been so grateful for their amazing response to the public need during this time. Healthcare has taken extensive measures from temporary testing facilities, safety precautions to protect patients, countless hours, and telehealth services to continue servicing those in need. Consequently, technology has answered the call for new service models and ushered in a new wave of adoption in digital health services. Today, I'm joined by Ali Youssef, Principal Mobility and Digital Health Architect with Henry Ford System, Scott Ebery, CEO at FG, and Doug McDonald, Director in the Office of the CTO here at Extreme Networks. And they're going to discuss the agile response, the technology trends, and IT considerations for a digital healthcare or a digital age in healthcare. Thank you all so much for joining me today. I'm really looking forward to hearing your insights on this topic. How are you guys doing today?
Doing great, thanks.
Good, thank you, Eric. I'm excited to be on.
Thank you. So, there's a lot of changes, obviously, and adaptive response that you all have taken in healthcare. I know that each of you has experience in healthcare. Obviously, Doug here at Extreme, you used to work for Henry Ford Health Systems. And so there's a lot of expertise here related to the healthcare models of yesterday and the agile response and recovery that we all experienced and witnessed throughout the time of the first initial wave of the impact in the pandemic. And what I really wanted to start off with is that agile response and that recovery that we saw. And I think my first question will go to you, Ali. How did Henry Ford Health System adapt after the initial impact that they experienced and onward?
Sure, yeah, thank you. I just want to make clear that, my vantage point is really very IT focused. So that's mostly what I'm going to be speaking around. But essentially, we have to pivot very quickly when the pandemic struck. And, initially, the initial response was setting up triage tents so that we could test as many patients as possible, and then having a framework around understanding, depending how far the tent is from our physical hospitals, how to provide adequate network connectivity in each of those scenarios. That quickly shifted to mock areas and mock ICU areas, as well as FEMA tents, some of which were on site, to accommodate the additional patient load. We had to start looking at areas in the hospital that were not traditionally ICUs and use them as mock ICU areas to accommodate the spike. We've been able to get away from that now, but that was during that initial onset. In addition to that, as you know, the TCF center was set up to accommodate overflow as well, and that was for about, I believe, around 1,000 patients across several health systems in the Michigan area. So the other thing that was happening in parallel with all this is, we had this tremendous push for remote work. So many of our, especially the folks in IT, whoever could work remotely was getting, pushed in that direction. And then an additional focus on telemedicine. And we'll talk about that a little later, but there was a huge exponential increase in the number of telemedicine visits. And as the numbers started to sort of settle down over time, now our focus is attracting patients back into the hospital. So we have something called the Henry Ford Promise, and essentially it has to do with providing a comfort level for patients to come back and do their routine checkups in the hospital. So that includes, focus on things like social distancing, automating healthcare screening at the entrances, and then rigorous sanitization as well, just making sure that we're on top of the cleaning and not really having restrictive entry to the hospital. You only need access if you need to be there, in many cases. So I think that's where we're at right now.
No, you're absolutely right, and I love that your focus is from the IT perspective into healthcare, because what we've seen is you've been at the front line. Technology has answered that call in a very real way, where we had to leverage technology and apply it in different use cases, and more importantly than ever, we needed it in order to safely serve those patients, like you talked about, those health services, the digital health services with telemedicine, and also the remote locations for testing facilities and things like that. These all require connectivity, and so it's been a blessing to be able to shift gears that way. And it's thank you for sharing, that initial transition. It's very interesting to hear. And there's another topic, though, related to that agile response that wasn't just about technology. It was the financial impact that was felt. So, Scott, I would love to hear from you. There's a lot that FG does to support healthcare and funding and different areas of their network as well. Could you tell us a little bit about FG and also the financial impact that was felt across healthcare, how you all were able to provide funding assistance and support?
Sure. And so thank you. So I'll give you a little snippet of us and I'll give you perspective. And then I'll talk about what we've done, what we've learned, and then the programs we work through. So FG is an independent network services company. So we are a group of folks that specialize in technology in the WAN business, local area network, voice, and wireless. So the world, Ali, you live in, we understand. We understand the chaos that you live in and the urgency that you had to deal with, because we personally have had to do the same. One of the unique things of us is we're an independent organization. So what I mean by that is we're not a provider of service, a carrier or equipment person. Now we work with folks. Extreme happens to be a great partner for us, and we leverage the Extreme network across many of our platforms. So as we start into this process and look at this, a couple setups. One is we view it from the business perspective. So there's a business around the infrastructure, right? So the business model change. So what we've just gone through is a business change, a change in how care is being delivered. In order for that to happen, you've got to have the underlying infrastructure that supports the business model. So that rapid shift has been an enormous shift. So the pressures on healthcare today have been, the pressures on us today have been financially, the healthcare system's huge drop in financial numbers. Number one. Number two, the models changed. So when you look at those two things, no money, model shift, that's a difficult place to operate in, right? So as you focus around that, there's a couple ways to do that. One, each one of these, the business model has an ROI to it. So there's a reason those things changed. Well, we were forced to change, number one. Number two, to have the patients, because the patients weren't inside the buildings any longer. They were outside the building. So when Ali had to do that, he had to go to the client. He had to go to the patient. So the shift of the model. So as I view these things from a business perspective, there's an ROI, right? There's an ROI on this change that had to happen. Number one, the first one I would tell you is survival. Well, survival and support the patients that needed our help going forward. Then let me back up a second. So one of our business arms that we operate under is we actually operate hospital networks. So Ali, we're in a position like we'd be a team next to you. We run the local area network. We run the voice network. So when you talked about people, we had the same thing, setting up COVID disaster centers, working around the clock over the weekend to get it established for our healthcare clients. So understanding it from the operating standpoint, but I look at it as a business. So survival, number one. Number two, the new business model. It was yesterday's model was, I call it more brick and mortar. We are in the buildings providing service, right? And that's the technology under there doesn't matter what it's called. It's the plumbing, it's the electricity, it's a utility to provide services. And that's what we do. We do it and it's important. In my view of that is you should never have to worry about what that stuff is. You should be able to provide services. IT groups are enablers of the business model. That's what happens. So there's an element of the old technology, there's an element of yesterday to today. And then there's a piece of this is when you look at the finances of it and you look at the business model and say, here's the old technology, the business has changed, here's the new technology. What are the drivers to get to that? And there are paybacks. There's modeling that you can do that says, by doing this, there's less labor and all those things. So the elements of finances you asked the question about, Eric, there are traditional business models that you could do to say, number one, we had to do it. We had no choice. Number two, there's a way to prove this in very well as you look at old to new and what it enables. But all of that considered, the radical shift in the 30-day movement, there are other ways to get dollars. So the government has actually put money forth to enable networks and to allow providers to invest in their networks because they have to, right? And so there's a couple different buckets that are out there today. Number one, there's the Health Connect Fund. That's about a $600 million fund that primarily supports equipment and wide area network elements that are out there. Most recently, about 2 weeks ago, they added another $200 million to that bucket. So there's a significant amount of dollars out there, and we do a lot of work on behalf of our clients to go get those dollars, of which, Ali, you are one of our clients, by the way. So we work for Henry Ford. Number two, there is a couple of COVID programs that came out right when it hit. The FCC went out and put dollars. And so two of those buckets were the telehealth program. Exactly what you just talked about. They put dollars specifically for those kind of applications. It was $200 million, and those dollars went away quickly. That's how quickly those were used because of the amount of things across the United States that happened. The third bucket that's out there that's still a continuing program is something called the Connected Care Program. And those are dollars, that's a $100 million bucket for folks to look at the new care model and get investments in dollars that'll support the operating cost to move forward to it. So again, significant business change. Infrastructure is the enabler of that. We cannot change. We have to change. And by the way, we should be changing ahead of the business model. That's the thing. There are ROIs on these products and on these networks, and there are federal dollars to support that. So all of that wrapped around, when you look at a business plan, you have a roadmap and a guideline. I would bet Ali had some plans maybe on paper. He just had to move really quickly because it happened to him fast. So that'd be my answer to your question.
Thank you, and very encouraging to hear what this, how that was provided to many healthcare providers in order for them to make that shift quickly. And you know, there's some other things that you mentioned there about technology being a foundational component, a foundational layer, and not just the funding, but the technology and how it's applied to the business model and how that determines the ROI that healthcare providers are receiving, right? This fundamentally changes the service models of how to deliver healthcare services to individuals. Like you said, the patients were no longer inside of the hospital, but they still have a need and they still need to be met. So that's very interesting to see take shape across so many organizations in healthcare, rather than, you know, this isolated pockets of smaller providers that you might find on an app somewhere that are, you know, startup healthcare organizations. It's interesting to see this take you know, full function across many larger providers like Henry Ford Health Systems as well. Doug, I have a question for you related to the technology and Extreme. How has Extreme responded to the changing needs in healthcare to align the network to their priorities and other use cases for safety precautions, mobility, and agile workflows that, you know, are going to come along with telehealth services?
Yeah, so Scott and Ali both obviously, talked very clearly about, what happened when this global pandemic hit, and really how we had to turn our businesses upside down overnight to respond to the new challenges. And Extreme, we did a number of different things. We work with folks like Ali at Henry Ford and others, and started to see, Italy was kind of on the tip of the spear for a minute and some of their challenges. So we were taking in all this input very quickly, and trying to understand how we can use our great technology to help, right? So first you have what Ali talked about, these pop-up sites and these triage tents and these testing tents. Well, all of a sudden you have your parking lot is becoming a place for a point of care. So how do you make that happen? So there's some very challenging things when that happens. How do you get technology out into the parking lot? And what we were able to do is leverage some of our great wireless technology and create some packages that could be very rapidly deployed, and that could utilize our mesh technology. So we could throw a cable to a wireless access point and start to connect some devices so folks could access scanners and printers and EMR, things that need to happen when you get forced outside the hospital walls into those unique facilities. So there's all sorts of interesting things and cool opportunities that we had. There was a large fairground opportunity where suddenly they're trying to do thousands of folks driving through with their cars. So we used a similar technology that was on the wired side to provide capability from a WAN perspective. And then we provided wireless isolation tent kind of scenarios. So you could get tested and then you can move in to talk to someone. Those were very important to really quickly come along. And we as Extreme, I think, there were some pretty late nights there. We were working literally around the clock to make sure that we could provide for some of these solutions. And the good news is we had these in our quiver. They were ready to go. We wanted to provide them at a good cost and get those out. So Henry Ford was one of the great organizations that were able to take advantage of that scenario. The other big scenario is, how do we now provide some access and some secure access to our home users? So suddenly overnight, now we're saying all non-essential staff, support staff, now you get to go home. Well, many organizations just weren't prepared to do that. So head ends like VPN concentration and things, we'll talk about that a little bit more, just weren't ready. So we created some hardware-based promotions that could be quickly sent out and quickly provisioned, so that we could have a hardware opportunity where you could connect in quicker and not necessarily have to depend on that VPN capability that may not have been scaled to basically quadruple the amount of people that went home. As things progress now, we also have some offerings that are interesting in contact tracing. So with our Extreme location and some of our capability on the mobility side, we have some interesting capabilities and solutions there and continue to try to innovate there. And overall, I think what's really cool is we have this overall business strategy to simplify our portfolio, to verticalize and to cloudify. So what does that mean? It really came into very handy when we had this crisis. What do we mean when we bring in simplicity? Well, we want to create agility. We want to be able to set up these sites very quickly, very easily, so that patient care can occur. We want to focus on verticals like healthcare. So we have the technology that can enable healthcare to be successful. And then we want to cloudify. So with the cloud comes a lot of very interesting things. With that comes agility and processing power and some of the abilities to move quickly when it means, was absolutely critical in these times. So I think that really aligned very well with this type of strategy for overnight. We need to change our business model, and we continue to work very hard on moving that strategy forward too, so that we can be more agile.
Yeah, absolutely. Rapid change requires agile technology, and it has to be as turnkey as possible to match the use cases they're servicing for very, very easily, very succinctly. And, when you talk about the cloud and the cloudification, I think what's really important there, and we'll talk about this, a little bit later as far as the IT considerations go, but it's the central point, the nerve system of the connections to all of your environment, anything interacting and connected to the network. And so in order for us to create new service models where we're extending beyond the hospital walls, we need technology like that to be able to serve those needs. So Ali, I have a question for you, going back to Henry Ford's health systems. There are a lot of the technology trends that we're seeing that we've alluded to a lot already, but there are some that may consider telehealth services a temporary response. Will we continue to see healthcare leverage remote care services like telemedicine and remote care to distribute the services where they need to go going forward? I mean, long term, will this be sticking with us?
Sure. So I'll give you, it's funny, it's a timely question because the administrator of the CMS, which is the Center of Medicare and Medicaid Services, released an article yesterday, and it's called "Telemedicine is Here to Stay," is the title of the article. And essentially, some of the statistics they cited is, before the public health emergency, there were approximately 13,000 beneficiaries for fee-for-service Medicare telemedicine sessions, essentially in a week. In the last week of April, nearly 1.7 million beneficiaries received telehealth services. So if you compare that increase, that's a pretty tremendous increase. So I think it's seeing very quick adoption. And if you look at our numbers specifically from Henry Ford, we had approximately in January, we had around 1,700 video visits. If you look at that number now, it's closer to 130,000 video visits. So that's an increase. It's almost a 100-fold increase in telemedicine services, which I think it's a trend that's here to stay. And based on what a lot of the EMR vendors like Epic and others are doing, they're starting to integrate that functionality into their platforms, which means, I mean, they see it as a viable option, at least for rural areas in the future. If you compound that with some of the remote diagnostic tools that are out there today, where you can kind of, including things like wearables and, but there are more clinical oriented diagnostic tools that you can send home with patients as well. I definitely think that's a trend that's going to be around for a while. I don't think it will replace traditional, healthcare institutions and medicine, but I think it's definitely going to fill a gap that was not filled prior to this, and just allow increased access for patients in areas that are outside of the major, metro areas.
Yeah, think about the cultural shift. I think part of the laggard adoption in telehealth services wasn't because the technology wasn't available, but the cultural adoption as well, the patient experience, the clinical staff experience, and then to your point, the ecosystem that supports that experience. It's not just, a single healthcare provider operating in isolation. There are various software systems that they're working with for their medical records, for diagnostic, visuals, and the IoT machines that are being leveraged inside of the hospital. Where does that data go? How do they access that data? And so a lot of these things were preventing or obstacles to widespread adoption of those things. And where we did see telemedicine, they were limited to certain use cases and types of providers, more for preventative health and check-ins and things like that. But I do see that the ecosystem has now been pressured in a sense by the circumstances to create those integrations that have removed a lot of the obstacles we've had before in that model being delivered widespread. I mean, wearables, for example, preventative health measures, that the opportunity to save someone's life proactively in the future by leveraging this technology more and more. I think the patient experience is going to improve such that they're going to demand it, they're going to want it, because you're putting the care and the power back into their hands for the flexibility of how they get serviced, especially in those rural areas as well. So I tend to agree with you, and I'm happy that you concur that it's definitely here to stay, because from a patient perspective, it's great. From an operational model perspective, as Scott was talking about, it's definitely beneficial. There's efficacies in the business models, the ROI that I'm sure Scott has seen, and likewise, Ali, you have seen as well, even at Henry Ford, right? I'm just curious, Doug, there's another factor that we haven't talked about related to the technology trends. There's the digital health services, but there's also inside of the hospital walls. Let's go back inside of the hospital for a second, theoretically, and think about what's inside of that space. There's IoT. There's been IoT in hospitals for a long time now that has been a topic of discussion as far as securing the hospital environment, but leveraging IoT use cases. But there's also robotics. We're seeing robotics and IoT being applied to the different functions that are happening inside of the hospital, like with precision surgery procedures, right? Things like that. How will those things be applied to create a digital healthcare workflow in the future versus how they've been used in the past?
Yeah, that's a great question. I think robotics in general is a really wide topic. There's unbelievable amount of innovation going on in this space. Some of it may be science fiction at first and may seem out of a movie, but there are surgeries that are happening now where a surgeon can be in a different country and do a surgery on you. And that's a pretty crazy thought. And maybe you're just in another hospital within your system, and that's taking place in another hospital nearby. So it's a pretty crazy thing to wrap your head around, but this has been going on for years. So there's some pretty cool technology. Of course, when you start to think about that, start to think about reliability of the infrastructure and the network, making sure that not only is everything nearly flawless or that hospital grade or life-sustaining grade network infrastructure, but you have the right circuits and the right bandwidth to be able to do this kind of stuff. So it's very cool and very innovative. And this stuff isn't just a science fiction movie. It's happening today. I know in Henry Ford, for instance, they do a number of surgeries in that way. With the robotics concept also comes something that's very cool, I think, in robotic automation, I think is a huge opportunity right now. And that is the thought of taking these really smart computers we have and the data they have and doing something special with it. So I think when you look just in general at the large aging population that we have, so you take the baby boomers, the demographic is extremely large. This demographic is aging and they need a lot more healthcare coverage. So when you think about the pandemic happens, you're already doing more with potentially less resources. And now you're going to be challenged to do that even more. So how do you do more with less? And that's a very difficult situation for healthcare. And I think what you're going to have to do is use some of this technology to improve workflow. Robotic automation is a deep subject, but the concept here, if we simplify it, is how could your system take out, for instance, the physician or clinician doesn't have to fill out that form. And there isn't human error with an address or with a name or with some sort of data that's being entered. Why don't we take that out of the daily activity for these clinicians? And that enables the clinician to see more patients and to spend more time with the human element of care and remove some of these things. So there's a lot of opportunity in robotic automation. I know that's very awesome opportunity for us as we move forward. And those are the types of things that we have to look at, leveraging this infrastructure and this cloud computing power and these systems that we have to be able to be successful with doing a lot more with a lot less. When you get into IoT, there's so much promise there, improving workflow by the minute. I've got a lot of personal stories where nurse managers and clinicians running up to me and give me a hug because we were able to take a workflow of some sort of clunky device that maybe didn't work well, and maybe you had to dock it, and maybe you had to tell this data that it was associated with this patient and all these different things, and now they have a scanner. And when they come and they take the measurements for the patient, it's going directly into the EMR. And that saved a tremendous amount of time and daily monotonous tasks. That's kind of the concept of using the IoT devices with that kind of automation capabilities. And IoT outside too, I think the building is really important. I mean, as a young man who grew up close to the auto hub in Detroit, Michigan, you know, we have these cars that have all these sensors. And these sensors can tell you that you should service your engine soon or give you indication that something's going on that's not quite right. And you probably should get it looked at before maybe there's a catastrophic problem. This IoT premise of the supercomputer we all have in our phones in our pocket and having some sort of sensory devices that could give us that capability of service maybe our heart soon. We have a very reactive healthcare model in the US and many other places where we have to have a heart attack before we're going to go into the hospital to find out that we have a problem. So I think IoT has such promise to start to change that paradigm where we get into a situation where we have service engine soon lights so that we don't have to go into the scenario where it's too late. I think that's a very exciting area.
Yeah, no, that's exactly what I was touching on earlier with the wearables example, that the type of proactive and preventative care that we can shift to by leveraging this more and more from an IoT perspective outside of the hospital. And your example about remote precision surgery, where the surgeon may be in a different country, different state, from the patient, I think that gives everyone accessibility to the best health care that they could possibly receive. But I'm also thinking, turning on how that shifts the ROI, the business models even more related to healthcare. So Scott, I'm gonna circle back to you there in a second. But I'm sorry, Ali. Doug kind of threw you in there when he said Henry Ford's got a lot of examples about robotics and IoT, such as that surgery example. Can you tell us a little bit about what Henry Ford is doing with robotics and IoT?
Sure, yeah. So I think he's referencing the Da Vinci robot specifically that surgery uses. But there's a lot of different examples of IoT that we're using today. I mean, ranging from building automation to different types of medical devices, to various types of sensors. So we definitely rely on IoT in many different facets within the health system.
It's a big part of the environment today and your streamlined workflows.
It is. It's a big enough part of the environment that there's a focus area around security around IoT within the health system, essentially. So
yeah, we'll talk about that just in a little bit on the IT considerations. Definitely a topic that we want to cover. Scott, I'm gonna turn it back over to you and ask you. We're talking about safety and precautions within the confines of the hospital walls. So with the use of IoT and automation, we do get one benefit that lends towards safety precautions, which is the reduced touch points. So how will healthcare providers need to reconsider their design for network connectivity with so much technology controlling the workflows, the automation, and the connectivity amongst the different softwares and software systems that they're using and devices that they're leveraging for care? I'm sure network connectivity needs to be designed to support that. What do you do at FG to help support?
I'll give you a couple perspectives, right? So there's in the building facilities we just talked about and all the neat things and wonderful things that are happening. I'll bring it to the business level. And then outside of that, you've all discussed a little bit about the rural environment. We are very active in the rural environment. There is a large portion of our population, there's the haves and the have-nots, right? And the inability to be able to reach those folks with all this stuff we're talking about, right? So as you look at that. So let me take the outside of it first. So real quick example from a client. We had an opportunity to take a look at a network of interconnection out in the panhandle of Nebraska. Anybody ever been out there? A beautiful part of the country, some of the nicest people in the world you're ever going to meet. They have 5 people per square mile. That's the population out there. They have one major hospital, Regional West, and then they've got 9 hospitals that are around that geographic area, along with about 33 clinics. And it's really genuinely the frontier of portions. Their old model, they only had the ability to service and support any severity of anything. They all had to be helicoptered back to the big hospital. They couldn't do anything locally. And how they did that, they had a little Polycom. You guys remember that stuff? They'd look at somebody on the gurney and say, how bad is it? And whoop, we got to move them, right? And what they would do with that, guys, is they would actually put all the records and stuff, put it on the patient's chest when they brought them through, because they couldn't get any of the data back and forth. There was no connectivity across that whole area. So the way they had to service these people was really, it was a have-not, I would tell you. So the infrastructure we were able to support via federal dollars, which I earlier talked about, we're able to put an 800-mile fiber network in place, leveraging federal dollars. The hospital systems own all that. This is not an FG. This is us helping and managing it. So what did all that mean? What it meant is the healthcare model changed. The ability, everything, Doug, you talked about, and Ali, you've talked about, if you don't have the connectivity with quality, low latency, high quality, you can't operate in that environment. So what it's allowed them to do today is actually provide services at a remote level, and whatever that is, guys. It could be all the things you've talked about. But again, I go back to my higher level discussion. Technology is an enabler. If we don't have this in place, we can't do all the business stuff. So change the way healthcare was provided in a remote area. And we do a lot of work in rural areas. We've got Illinois Rural Health Network, which is 60 hospitals in Illinois. All of these folks are suffering at the hospital level. So how can we bring, to your point, Doug, things to the cloud, provide services and support to allow them to operate better? You know, traditionally, and I'll move to the inside of the hospital in a second, traditionally, when you look at economic development in these small communities, I've got a lot of experience in small communities. If a hospital goes, which we're seeing a lot of hospitals go out of business these days, these smallers, there goes the town, right? So the anchoring of that with the right technology and the right service doesn't mean they have to provide it all, but they can get it from others. And the technology we're talking about enables all of those models going forward. So inside the hospital, a lot of great things happening, and we've got a lot of experience in with these kinds of things. But we've seen an enormous amount of, I'll just say for an example, wireless changes. We had a client that we went through, and they're a client of Extreme also. We put through a process. We moved their wireless access points. We 6x'd them, number of them out there, Ali, and you'll appreciate this because you see the demand. Completely changed the way they've provided healthcare, nurse call, all the things you guys are chatting about. The mobility requirement inside a hospital is enormous for safety, security, and then you overlay the network elements. And when you have that much demand and requirement at the client side, it's touching the client, the patient, you've got to have the element of quality. It's got to be there all the time. It's got to be secure. It's got to be flexible. And again, when we talk about network and doing it the right way, that's what it does. So I think the network connectivity to me is more important than ever before. And the stuff that we're talking about today is hugely important. I would argue, and I've been on a lot of board meetings, CEOs don't get excited about the network, but when they understand it enables all the stuff they're doing. Because if the network's not there, what happens? I bet you Ali's phone rings. It ain't working. So strategy, design, and putting the infrastructure in place with the flexibility and a lot of the capabilities we'll talk about in a bit that Extreme has, I think is an enabler for the future. So
yeah, it's essentially the highway. The way that you were describing it in rural areas, I'm thinking about building out highways. I mean, before we built out this massive infrastructure to get from point A to point B, it wasn't such an easy travel or commute to get from one place to another. A lot of people stayed where they were for most of their lives, right? And this is the way I see the digital age. Is it's become the central nervous system of everything that we do. And you're right, I'm sure Ali doesn't get a call when everything's working smoothly, but the second that it's not, and it's about how do we shift IT? And I think that's what's happening during the pandemic and the pressure that it's applied. It's really about shifting IT from the tactical of, well, let's keep the lights on. Let's make sure, you flip the switch turns on, we're happy. But now we want to walk into the room and it automatically knows we're there and it starts to turn on the light. And when we leave, it preserves energy and saves costs and things like the same type of analogy applied to networking. How can it work for us strategically as an extension of our workflows and infused into those workflows and a part of our day-to-day as opposed to a augmented portion of our life and our work. So there's another question though, that as you guys have mentioned this a few times, it's the IT considerations, it's the network foundational components within the environment, externally or internally to the hospital walls, that outside of the network connectivity, you have to have the layers of the network, the foundational components to enable a lot of what we're talking about. But IT is one of those things where we design it for the need. We created networks originally to design simple connectivity, simple use cases amongst workflows and how we're leveraging it, right? And now it's really changing to where we need to design and consider those designs for new use cases, distributed models, distributed environments, flexibility and agility within our workflows. So Ali, can you tell me, where do you see providers prioritizing IT investments in support of digital healthcare services to enable these use cases where it's not an afterthought, but more a critical component? And how do you guys design at Henry Ford Systems your IT environment to enable the agility of your workforce and the flexibility?
Sure, yeah. So I mean, from a budget standpoint, after COVID, definitely we had some struggles with our budget. We have to really prioritize some things and figure out, what can be pushed out and what do we need to tackle immediately. So some of the things that, and the government did help a little bit, like Scott alluded to earlier. I mean, with the CARES Act, the FCC had some funding for telehealth specifically, which we qualified for, which was great. That helped. It didn't offset some of the losses that our health systems, and I'm sure many others, have felt. Who would have guessed, elective procedures are the main money-making, entity that's helping keep health systems afloat. So I wonder if our whole healthcare strategy in this country will change after this pandemic. But anyways, if we focus on sort of what we're focused in on, a lot of it has to do with automation, like Doug mentioned earlier, and looking at mobile devices and trying to automate the provisioning process of the devices as they join our network. So being able to automatically identify, what they are, what they're allowed to access on the network, and have some sort of fingerprint of what to expect, what type of traffic patterns to expect from the different types of devices. So we're very focused on that. But in terms of, the specific services, I think telehealth and increasing the telehealth footprint is definitely a huge priority. Automating. So when you look at, when I mentioned the Henry Ford promise, really to give people a comfort level to come back into the hospital, there's three facets to it, right? I mean, one of them has to do with UV light sanitation, and there's been a lot of companies popping up that specialize in that, including, cleaning the air as it circulates through creative ways, with different light bulb enclosures and things like that. But there's also the contact tracing element, and then there's the kiosk element where you're actually measuring, and it could be argued how effective the kiosks actually are, but at least you're doing something. As people are walking into the facility, you're measuring their temperature and maybe some other metrics and a questionnaire and things like that. So that's certainly a focus area. And then really the other piece has to do with, and Doug touched on this as well earlier, has to do with security and securing our remote workers. When you have this sudden shift, from 10% to 100% teleworkers, a lot of people are not used to working from home, and they're not used to taking the precautions necessary when you're doing that. So we've seen, if you look at a lot of the security reports out there, there's been a huge spike in phishing attacks recently and other types of attacks. And really the home environment, it's an ideal target if you're in that business, because depending on how you're using VPN, it's kind of restrictive depending on your design. Really, it has a strong dependency on your upload speed, which if you look at your home connection today, usually that's a lot lower than your download speed, significantly lower. So it definitely it puts a kink in your quality of experience when you're exclusively using VPN. So on occasion, you find yourself not using VPN, and that's where I think you can get into hot water, depending on your home setup. Even I'm a network architect, and I have to pay special attention to make sure that I have the right measures in place, because I have my children on the network, my wife, doing various things. So that's been a focus. I think the other key focus that was surprising to me is just creative use of video. When you think about video, you're thinking about web conferencing, telemedicine. But one of the other use cases that was interesting, or there's a couple. One has to do with providing patients with the ability to reach out to their loved ones because of how isolating COVID is. Once you're in the COVID ward, you're pretty much done. I mean, you can't communicate with your family members anymore, or at least it's more limited. So adding the capability to have video and things like FaceTime and other types of platforms to have that communication, I think has been crucial. And then the other piece is localized video monitoring for our nurses. So having the nurses from their nurse station be able to check in with their patients without having to put on PPE. And as you know, there's a huge shortage. So there have been some trends with video that are trying to curb that shortage, so you don't have to go into the patient rooms as frequently. So those are some of the interesting things I think that we're focused on.
Yeah, that's very interesting, particularly with the use of video. I mean, there's loved ones that are being prevented from seeing and comforting their significant others, their family members, and even if they pass away, God forbid, you can't go to the funeral. It's very limited gatherings for that. You don't want to get exposed to anybody that was around them. So it's challenging. And I see that though this pandemic has been eye-opening for how we can leverage technology to better serve the needs of people during times like these, I think that there's always going to be a virus in the future. There's always going to be an illness that's contagious. And I could see that would be applied to the hospital and the clinical staff, how they leverage video to continuously monitor those that are of high risk for a contagious outbreak and whatnot, to protect themselves, but also still give access to their family members. I'm thinking of nursing homes and how tragic it's been for, my cousin, she's a nurse in the hospital. She's an oncology nurse. And she was telling me that one of her patients that she adores, he was turning 93. And she said, "What are you going to do for your birthday?" And he said, "Well, I would love to spend it with my wife, but she has Alzheimer's and she was in a nursing home. And so unfortunately, they would not let him see her at all. There wasn't, if there was at least video that he could have used, or maybe in his example, it wasn't quite feasible given her state of mind, but that's time you don't get back. You can't reschedule that. And you don't know if you'll live to 94 after 93, right? So this is a very critical time. And when you talk about the technology and how it's being used, it's not just for the sake of our convenience. This is bringing people together. And we've seen that even with all of us in quarantine for the most part during that time, leveraging video to stay engaged with each other. So very, very interesting. But you talked about the security of remote connectivity.
Yes.
What about security of IoT inside of the hospital? I'm sure that's a major factor for you all.
It is, yeah. So one of my focus areas is medical devices specifically, and keeping up with that security demand. And it's quite challenging. I mean, you do need a certain level of automation to understand what inventory is on your network in the first place, and then understanding things like firmware, appropriate firmware for each type of device, appropriate segmentation. So Scott mentioned mobility earlier. One of the things that I deal with has to do with the use of frequency. Different medical devices, different types of devices in the hospital using the frequency in different ways. Sometimes you run into coexistence issues with these frequencies, where devices step on each other or interfere with each other. So certainly, yeah, focus in that area.
Right. Doug, I would love to bring you into this part of the conversation as well. There's segmentation seems to be the critical component for me when I think about IoT, and the function of the IoT devices. They're very limited. They have a very specific use case. And so we should be thinking about segmenting and designing differently for security measures when it comes to IoT. How do we do that?
Yeah, I think could be the $1 million question, right? So how do we secure all these devices? How do we enable a capability for our hospital administrators to be able to wrap their hands around this without having to have these gigantic staffs that have to run around and put their hands on devices and all these things? So to Ali's point, I think the key there is automation. And I think what you really need there is a very strong, like, centralized management platform that can give you the capability to track and to create policies for segmentation or micro-segmentation of these important devices, so that you can start to automate that capability. Meaning, when I connect this widget, this intravenous pump on the network, we know that it gets this specific policy from the network system, and then that policy enables it to talk to certain devices, and then there's no IT need to go and create some sort of separate network or all the complications that come with that. So we start to look at, there's different industry constructs that we can look at a higher level. IEC 80001 is a really great one that provides for great recommendations for standards and best practices for truly protecting your medical device network and really any device in the infrastructure at the hospital. We look at matching those kind of best practice risk mitigation strategies with some sort of automated, centrally managed network that we can containerize and segment automatically. I think that's the future of how we manage the number of devices. And it always kind of cracks me up when you read some of these industry analysis and they talk about the number of IoT devices, and it's literally in the billions. So how could you possibly manage that with a IT staff or medical staff that's already at their max? So the way we're going to be able to do that is to put good policy in place from a how do we want to do this as an organization, and match that policy with the technical policy that's going to automate and enable you to create less things that can fall through the cracks from a security perspective.
Yeah, and to your point about the centralization of that management, these billions of devices in the grand scheme of things, right? But even in a hospital, you have several hundreds of IoT devices in a given area, right? Just the things that you don't even think about, even the vending machine can be connected to the network, right? It's not just the healthcare devices that are being leveraged, but how important then will visibility and data insights? I mean, the world that we're talking about, the Jetsons like future of healthcare, where it's proactive and preventative, that requires data and insights and analytics to be able to make those informed decisions at a very key critical point in the in that workflow of that patient experience, of the doctor's response, etc. So is cloud going to be more widely adopted in healthcare? I mean, traditionally it hasn't been. Will we see more of that in the future?
I think absolutely. I think the cloud is that maybe the silver bullet that we've been looking for to help us bring together these things. So I know when I was in the operational trenches, we always struggled to take the data and present it in a way that was usable. There's so much data, and we get our servers were slowing down, and we're trying to run these reports and try to do things to be proactive, and it was very difficult to do that. We were always asking the server teams for more processor and more RAM and more bigger boxes, and I think that's something that the cloud really helps with, that you get this big data computation capabilities that are very critical to processing the number of devices and transactions and things that are happening. But I think overall, really, and Ali hit the security piece of it, but I think the cloud creates an ability to focus on security, performance, flexibility, and resiliency. And if you put all those things together, that is where I think you can be successful from a healthcare IT perspective. Performance, you're getting these insights. Hopefully they're more proactive than reactive. The flexibility to quick deploy things, like when pandemics happen and suddenly you have to change your workforce model and you need those connection points to be secure and to be quick and agile. And resiliency, you've got to have an architecture and an overall system that's going to enable you to provide that health critical network. So I think when you put all those components together, the visibility and the insights and the automation piece to the security conversation, that's really the future of how we leverage our technology to be successful in healthcare. Yeah,
that's a great point. And just cautious of time, we have just about 10 minutes left or a little bit less. So I'm going to ask Scott, I'm going to ask you one bleeding question on my heart, and then I'm going to open it up to Q&A, and we have a few questions that have been rolling in, so I'm going to throw those out towards you guys. So Scott, before we move into Q&A, how will regulations and compliance adjust for incentivized adoption toward digital healthcare models? I mean, we see that we saw that happen with EMR, the shift to electronic medical records. Will we see that again with digital healthcare models?
I believe so. So I'll give you multiple answers, right? Perspective. So I'll give it to you as the business person, outside of regulation and outside of government money. What the patients are going to expect this type of model. The concept of everybody's going to go back to normal inside the hospitals, I don't believe is going to happen. I believe we are going to be in a position that the new world is a digital health and distance. Now, that doesn't mean they don't come back to the hospital. I don't want to imply that. They will come back. Docs still need to see patients, but that element is, so we don't have a choice. So with government money or without government money, it's happening. So my argument on a business perspective is there is a model and an ROI to think about. And how do you leverage technology and the value of technology, the security aspects, the flexibility, all the things you guys have been talking about today is there. The second side of that is traditionally the government has done the carrot and stick model, where they incent you to do a certain thing. They've done that in the EMRs over the years. And if you don't do it, you get penalized, right? And I haven't seen that in the model yet today. They have taken down barriers to allow this compensation to be there. So I think that'll continue to be. And I've also seen indications just in the funding work that we do, the increase of funds from the government coming to enable these technology things. So it is my hope and belief that they'll continue to support this because they want to help accelerate. And I believe in the right regulatory environment with the right kind of incentives and the right kind of business thoughts around that, proving these things in technology, this technology requirement's going to have to happen to enable this new model. So I believe the future is going to be right along the lines of what you guys are talking about. Again, I'm the business guy looking at this stuff. I always tell people when I'm in front of a board, what I'm talking about may seem German, a little foreign to you, but it's the requirements for what at the board's talking about the care model. How do we care for our clients? You talked about the Henry Ford motto. And I mean, I've got clients that have actually created a virtual hospital system today, guys. They've changed their model. They've got brick and mortar, but they're going there. So there's so much momentum. I don't think we can stop it. I think the government will continue to support it. I think this technology will enable it. And I think there's a great opportunity for technology folks in this business to help the business people move it forward.
Absolutely. Red tape has a way of slowing you down, and we've seen that lifted tremendously to make way for these new service models to be delivered to patients, to keep their safety as a priority, to keep the safety of the clinicians as a priority. But what we've seen come out of it are efficacies that we don't want to take back. We enjoy the flexibility, we enjoy the mobility, the agility and the workflow, the streamlined operations between the clinicians, communicating with each other, accessing the right data, and engaging with their patients, etc. So I definitely see that now that the veil has been lifted on, wow, what can happen when we apply technology in a real way and leverage it that's in a way that's optimizing our experiences and our workflows and our ROI. There's no going back. So I love that your opinion is of that, so that I can be hopeful for the Jetson healthcare of the future. So I'm going to open it up to some questions here that we've gotten from the viewers. The first one I have up, I'm going to direct towards you, Scott. It's, as healthcare providers are continuing to evolve, where are the financial investments being made for a successful transition?
It could be a really big question. So I'll get it to the world that we're living in today, right? So I'll give you an example. So an example would be, and I will cite the Extreme platform. We went through a process with one of our really large healthcare providers as they were looking at their network and where they needed to go, because this is the system that was going to go virtualizing and doing different model structure. And so when we looked at it, there was a development of a CapEx and OpEx requirement that happened. We went to the marketplace, looked, and we chose the Extreme network. We chose to deploy Extreme within a hospital system. And the justifiers, as we looked about that model, were really about the things that you guys have talked about. So the ability for availability, flexibility, security, because if you don't do that, the costs of that are enormous. They are absolutely enormous if you don't manage that properly. So by making those investments up front, our payback has actually gotten faster because of the reduction of labor, the other elements of having to put, I'll call it Band-Aids, not being the technical guy, but you probably have better words for it, but I'll say Band-Aids around the problems. Those cost money. So the labor, the technology, and then the overarching side of that. So there's a hard dollar savings that happen to that. But more importantly, the client interface or the patient interface has been outstanding. And so I would tell you that I think that the right investments tied to the right business model. There may be incentives or not incentives, but I think there's that opportunity to it. The other thing I would tell you, and as I said earlier before, but I saw a study that went out there, this model's not going to change. Think about the younger generation, those folks, their behavior. There's a study out there that shows telehealth, and so they consume it. The younger generation doesn't have a doctor-patient relationship. They're just going to telehealth. And so that there's so much dynamic happening there. If you don't make the investments to get yourself in a position to be able to provide that service, you won't survive. So I think proper investments that give the underlying technology to the supporting of the business model is, you have to justify those. So I think that's where investments are made.
So in other words, it's not a one size fits all. Assess where you are today, your readiness today, and figure out the best path forward. And secondly, even if you think that you're great in the position you're at, in the region you're in, the patients that you have, consider this. The next wave of patients, the next generation, are going to be conditioned to leverage this type of experience in healthcare. So we want to make sure we're also preparing for the future generation that will be conditioned and will want these types of services.
Yeah, and then the business side, and I'll wrap mine up. Because of this virtualization, what's happened at the business level, it's changed. So I no longer have a geographic limitation. So healthcare entities have a geography, they're my market. You may have a competitor. With this telehealth and this virtualization, the leveraging the cloud, the model changes. You have so many more people providing it. So again, at a board level, at an executive level, you need to be thoughtful about where it's going and understand that infrastructure and technology is required to survive. It's not a nice to have, it's a have to have. And when people understand the strategic value of infrastructure tied to the business model, they get it. If they think it's an expense item that they're trying to keep low, they won't get to the model they need to get to. So that's my public comment, but it's also my experience. So
yeah, the public service announcement.
Exactly.
Very, very good insights. I love what you have to say on the topic. Let's see. There's another question here. Ali, I think you're the perfect person to answer it. It's, how will the patient and clinical staff experience continue to change or change?
Sure, yeah, I think it's definitely a brave new world, and a subset of the patients will be using telemedicine over time. But I agree that, you know, brick and mortar hospitals will be around for a while. And I was looking at an FCC publication recently looking at, you know, broadband adoption in the US. And there's about, I think, 19 million people, about 6% of the population, don't have access to internet. And then out of the folks that do have live in areas where there is broadband access, there's about 100 million people that are not taking advantage of it. So, you know, we cannot leave that part of the population behind as we're adopting these new measures. There have to be ways, I think, to be inclusive of that portion as well. So I think there's going to be some creative things are going to have to happen, I think, and to accommodate that portion of the population. Maybe, you know, in some cases you can have them go into the nearest clinic as opposed to a major hospital and have a telemedicine session from there. There may be creative ways to do that. But I can see a lot of the business aspects of healthcare and folks that are not on the front lines. I think a lot of that is going to continue to be remote. Now that hospitals and healthcare systems are realizing that the tremendous cost of real estate, you know, what am I actually getting by having all these employees sitting in a facility as opposed to being remote? You know, I think we were forced into it quickly, but I think, you know, there's going to be a realization there that over time that we may not go back to that original traditional, you know, work from an office type model.
Yeah, you might be repurposing that space, and maybe part of that repurposed space that's not being leveraged as much could be, I don't know, here's an idea, telehealth clinic, where it's just set up for people in rural areas, for example, that don't have connectivity. Like you said, you can't leave them behind. That space could be a safe environment for them to come in an isolated room where they can be there by themselves, have their visit, soundproof door, so that you can maintain HIPAA, But if that space isn't being used and you're in an environment where it's rural, like Scott was talking about earlier, these rural environments that don't have connectivity, that might be a cool repurposing of space. But I'm sure the possibilities and ideas are endless. Let's not run with that one. That was just a random one today. So thank you, Ali. That was very helpful. So last question in queue, and then I will wrap this up. You know, Doug, I think this one should go to you. It is about the learning curve toward adoption in the technology. So will we see a learning curve that we're going to have to answer for with clinical staff and even patients that aren't used to accessing technology like this? I mean, I'll give you an example. I was during the start of the pandemic, I had a doctor just after surgery who needed to do a follow-up appointment with me, and we were forced to do telemedicine. And poor guy, we got on Zoom, and he's like, Erica, I don't know how to do this. Am I doing this right? And I'm like, yeah, just, I can see the ceiling. I'd like to, little things like that. How will the adoption and the learning curve impact the patients and the clinicians?
Well, I think there's certainly a learning curve there, and I've got plenty of stories here, but my parents are large consumers of healthcare, and my father just did his first telemedicine consult on Monday. So it was just a follow-up appointment. They've got an hour plus drive, and now that we're getting back to work here, the traffic is crazy, and he's high risk. It's a very great opportunity to put some of these things we've been talking about. Why go to some sort of place where there's just might be a greater chance than sitting in your living room? But of course, that comes with price to admission. I think the social media evolution has helped a lot. I think of the baby boomers get engaged in using technology. And there's been a lot of really cool stories I've heard or come across lately. My grandmother is in assisted living, for instance. They've been cut off. You mentioned just some of the horrors of that situation, the isolation and no visitors and all those things. So we're able to give her an iPad so that she could communicate with the family and be involved in some of the things where she may not otherwise been able to be a part of. So I think absolutely there's going to be a learning curve for this stuff. But I think the benefits of this outweigh maybe some of the anxiety initially that occurs when you're trying to adopt a new technology, or I've never used this before, or I'm terrible with technology. I think that's really important. I think Scott touched on this as well as Ali. When we start to simplify that user experience and that patient experience, and we start to look at opportunities of telehealth and aging in place and all the great things that may have been accelerated significantly or have been accelerated because of this crisis, I think there's almost unlimited opportunity to move forward with folks to be embracing the technology and for it not to be scared. Now, as an IT administrator in the past, the security stuff can be scary, and how do we connect all these things and be resilient? Ali touched on, maybe his kids are using the Xbox or streaming YouTube, and mom is trying to have an appointment, and sometimes that can create some trouble. So I think as we continue to move outside the hospital walls, that's where some of that visibility component of the cloud and some of those other things come together. When we think about the concept of assurance, how can we look at Ali's home and say that it's okay and it's performing well and he's kind of good to go before he may be in the thick of it with his doctor? So I think those are some of the things where we as technologists can assist that user experience. And I think as it becomes easier and more adopted and more opportunity there for the benefit, when you save a 2 or 3 hour drive and you don't have to mask up and disinfect yourself and all those things, I think really we'll get a lot of drive for this kind of new world order, the new normal of healthcare capabilities.
Well said, and a proper ending. We are out of time for today's session, but I want to thank you all again so much for joining me and providing your inputs. It's been a pleasure to hear each of your perspectives. As a reminder to all of you watching the webinar, it is recorded and you will have access to this recording within 48 hours. So feel free to watch it back again, hear the amazing input from all of our panelists here. Thank you for your questions and have a great day.